Hello, and this title is Who is that masked man? Now that we're all being asked to wear masks when we're out in public, I thought I'd cover it. Now this is your basic surgical mask. This is it's what's called the ear loop because you see the loop, so you'll see these very common. So this is what most dentists use, and we want to talk about how to put it on properly. Obviously, once it's been used, if it touched you in any way, it's now contaminated. So you want to be very careful about not touching the large surface. I'm going to try to just touch nothing but the ear loop part. I take my fingers and I expand it so it goes over my ear, and then I'm going to put it over my ears. Okay. Now there's one other little function you have to do with these is you have to pull them over, and then there's a little metal, bendable metal bar in there that allows you to seal it around your nose. So the important part of the mask is seal. Now let's talk about these masks. These masks are meant to prevent, if you were sick with any cold, flu, or COVID, that with the little spittles from your breathing and sneezing and coughing cannot penetrate and get out into the environment. So it's all about preventing, if you are infectious, even though you don't know it, because you can be infectious and not know it, giving it to someone else. This is not a mask that helps you prevent from somebody else giving it to you, like it would filter the air. This is not designed to filter the air. This is designed to keep your fluids from getting out into the environment. So once it's on like that, you don't want to touch your face and nose, because again, now it's contaminated potentially, right? So now we're going to go over here, and we're going to talk about gloves. A lot of you are talking about gloves. There's a similar thing about gloves. Once it's clean and you touch it, it's not clean anymore. You now have, once I've touched this is now potentially a contaminated. You, of course, would have washed your hands. Now, you notice how I'm holding the glove by the very little edge, because you don't want to be touching this area if you can avoid it, because you want to keep that as clean as possible. You do this one end, obviously I've done this a lot, but even then, again, you pull it on, done. Second one, gonna grab it, gonna pull it on, and done. So if your hands are wet, you're going to find this very difficult to do. Little baby powder inside, just a dash that will really help slide it on, because the gloves don't like to go over a wet surface. Okay, now, once I do something like maybe touch the surface or touch this mouse, touch the keyboard, or touch this door handle, these gloves are not contaminated, right? Don't want to be touching, and if this is an area that you think hasn't been cleaned recently, you're going to want to remove your gloves before you go anywhere else. Again, don't touch the surface. You're going to want to grab the end of the glove and pull it off like that. See, I've left it in this hand. My right hand, I'm going to grip, and I'm going to pull this glove over that glove, grabbing the inside like this. We're going to now take this and put this in the trash. Okay, so this is a good time to wash your hands. I won't go through that because we already had a video about that. Now, to remove the mask, same thing. You're only going to touch the ear loop, the elastic's ear loop. See how I'm removing it? Trying not to touch the mask part. Take that off in the trash. Okay? Wash your hands. There we go. Thank you. Bye-bye.